Hello everyone and welcome to Nursing to Be and to Do channel. This is your one-stop shop for everything nursing. This channel is to break it down for you. Everything nursing is supposed to give you in layman's terms nursing diagnosis, nursing practice and rationales, disease processes to help you and equip you with information to make decisions as you encounter some of these problems in your life's journey. So my goal and commitment is to ensure that I break it down for you to an understanding levels where you could make meaning out of it and be able to make decisions. Today our topic for discussion is a cerebral disease that is very popular and has a lot of negative implications. It's unfortunate that we still have these diseases that keep occurring and inflicting people and causing harm and grief to family members. The disease in question is cerebrovascular accident, CVA, aka stroke. So stroke is a disease that affects the brain. It affects the circulatory system of the brain. And I'll give some background. The brain is enriched with blood vessels to provide nutrition, oxygen, water, and any other nutrients that the brain needs. Just like the other parts of our body, the brain is so rich in blood supply to help feed and provide its needs. The two main vessels that supply the brain with food, nutrition, oxygen are the carotid arteries. Okay, the carotid artery feeds the frontal part of the brain to the middle, and then we have the vertebral arteries, which start from the back, from the vertebrae, all the way to the middle, and it forms a mesh, like a network of connective vessels that encapsulates the vein and the brain and feed it with all the nutrients it needs and enrich it with nutrients, oxygen, everything that it needs to be able to perform its job, for our thought processes, to help us make decisions and stuff like that. Stroke occurs when one of these vessels that supply blood rich with nutrient, oxygen, and water to the brain is in trouble. When one of the vessels is in trouble, then stroke occurs. There are three main types of stroke. The first one, which is not good at all, is hemorrhagic stroke. It's not good because recovery could be very challenging, and it has poor prognosis, especially compared to the other ones. That's why I'm saying that it's not good. It's not a good kind that you like to have in case you go that path, but God forbid that it happens. Hemorrhagic stroke is when the vessel, connecting through the brain gets ruptured or breaks and blood oozes out into the brain. It could be due to several reasons that we don't have time to talk about. So hemorrhagic stroke, there's a rupture or a break in the transport of oxygen, nutrients, and water to the other side of the brain, and for that reason the other part is deprived of those nutrients because there's a rupture in the vessel. The food, nutrition, and oxygen that is supposed to cross over to that side doesn't happen, and that side of the brain begins to die because there is no crossing over of those nutrients. And then there's another type called ischemic stroke. Ischemic stroke is a blockage, okay? Unlike the hemorrhagic, which is a rupture, ischemic is a blockage where there is a block preventing the crossover of nutrients, oxygen, and water and other essential food for the brain to cross over. Doesn't happen because there's a block and it can't cross over. It could be anything from a clot formation, a plaque from cholesterol buildup, or anything, that happens. But usually it's a blood clot due to inefficient inefficiencies in clotting mechanisms of the person, or it could be from high blood pressure. There are several reasons that could cause, but for the benefit of this video, let's stick to the simplified version and the main reasons. So ischemic means it's a block and food is not able to cross over to the other side of the brain, and that side of the brain begins to die because it's not getting its livelihood, the source of nutrition and stuff is cut, so then it begins to die. Then the third one is TIAs, those we call mini strokes. Those happen when there is narrowing of the blood vessels feeding the brain. Sometimes when you have buildup of plaque or things in the lining of the lumen of the blood vessels, it narrows it. The blood vessel is like a pipeline. Let's say it's like a pipeline allowing blood to flow through. But when there are deposits of substances on the walls, the inner walls of the line, it decreases the opening where blood can flow through. So then it diminishes the amount of food, nutrition, oxygen supply to the other side of the brain. And those, when sometimes it gets corrected by itself when the person is put on some form of medication, so they go under procedures to open it back up. It resolves the problem and there are no deficits at all. You don't suffer from any weaknesses or any brain problems or nothing. So then you are lucky and it doesn't affect you. So the three main strokes is what we covered: hemorrhagic, ischemic, and TIAs or mini stroke. That's the background. I'll be coming your way again with a simple acronym that you could remember to identify and detect stroke so that you could respond rapidly to seek medical intervention. Thank you for watching.